So if a woman is consultant-led, she may go onto the labour ward to have her baby. Doctors are available on the birth centre as well. Anytime if there are an emergency and doctors need to be called, the midwife would press the emergency button and the doctors would come along. I wanted to mention that as well. But if you're consultant-led, the woman tends to be on the labour ward. However, if she is consultant-led and she would like to use the birth centre, it's always worth asking the question if that's possible. It might be, it might not be, but if you don't ask, you'll never know. So I always ask that question as well. The rooms are still really lovely. We're very fortunate here. We have lots of really lovely hospitals, certainly where I am in the southeast of London. The rooms are still nice. They're still going to have like dimmer switches that the labour ward rooms would have, and blinds that you can pull down, and you can completely adjust that room however you want to. So if the bed, when you walk in, the bed's in the centre of the room, you can push the bed to one side. You can lower the bed down so that you can sit on a birth ball and lean forward on it like this, or you can make the bed high so you can stand up and kind of lean forward like this, standing up. So you haven't got to hop on the bed just because it's there. It's quite a good thing to actually get that bed out of the way so you'll be more active and make a little nest on the floor as well. You're still going to have an ensuite there, as mentioned in the previous video, so bathroom, shower, maybe bath, and birth balls will still be available as well. So the rooms are really lovely. Do remember you can adjust them however you want to. That's your room to kind of move around and change around, whatever you want. And yes, if you need to be monitored more closely, if you want to have an epidural, if you're having a labour induced, there's a good chance you'll be on the labour ward. However, some women are able to have inductions on the birth centre if the first kind of round of the induction process is fairly straightforward and tips a woman to labour. She may then be able to go and use a birth centre and carry on as she were, if you like. Oh, one other thing to mention, yes, and on the labour ward, you're going to have access. Some have pools plumbed in, or inflatable pools. You'll have access to diamorphine or pethidine or whatever opiates your hospital uses. Gas and air is available everywhere as well. TENS machine if you bring that along with you, and epidural.